The prostate is a small gland located just below the bladder. It surrounds the urethra, which is the tube that carries urine out of the body. Even though the prostate is small, it affects how a man urinates, how he performs sexually, and even how he ages. Most men do not realize how important this gland is until something goes wrong. As men get older, the prostate naturally begins to grow. This growth is mainly caused by changes in hormones. Testosterone slowly decreases. Another hormone called estrogen becomes slightly higher. And inside the prostate, a stronger form of testosterone called DHT begins to build up. These changes happen slowly over the years and they cause the prostate to enlarge. This condition is called benign prostate enlargement, and it is extremely common in men over 40. It is not cancer, but it can still cause many problems. The first signs often appear so gradually that many men think it is just part of aging. The urine flow becomes weaker. It becomes harder to start urinating. You feel like you have finished, but then a few drops still come out. You start waking up at night to urinate. You notice that you have to go more often during the day, even when you did not drink much water. You may feel a pressure in the lower stomach or a sense that the bladder is never fully empty. These changes happen because the prostate surrounds the urethra. As it grows, it gently squeezes the tube and this slows down the flow of urine. If the enlargement continues, it can irritate the bladder. This causes urgency and frequent urination. Over time, ignoring these symptoms becomes dangerous. In very advanced cases, urine can back up into the kidneys and cause kidney damage. This is why early understanding is important. There are also silent symptoms that men usually overlook. Pain in the lower back, a dull ache in the groin area, feeling uncomfortable when sitting for long periods. Some men also notice changes in sexual performance because the prostate plays a role in ejaculation, and nerves in that region can become irritated. Certain lifestyle habits make prostate enlargement worse. Sitting for many hours every day increases pressure on the pelvic area. Being overweight, especially with belly fat, increases estrogen and speeds up prostate growth. Eating too much sugar-fried food and processed meat raises inflammation. Drinking too much alcohol and caffeine irritates the bladder and makes symptoms stronger. Stress also plays a major role. When stress hormones rise, the muscles around the prostate tighten and the symptoms feel worse. The good news is that men can protect their prostate with simple daily habits. A diet rich in vegetables, fruits, and healthy fats supports prostate health. Tomatoes are especially beneficial because they contain lycopene, which reduces inflammation in the prostate. Pumpkin seeds provide zinc, which helps balance hormones. Salmon, sardines, and other fatty fish contain omega-3, which reduces swelling. Green tea, turmeric, garlic, berries, and broccoli are also supportive foods. It is helpful to reduce foods that make the prostate more irritated. These include processed meats, sugary drinks, heavy dairy, fried foods, and very spicy meals. Alcohol and caffeine should be taken in moderation, especially in the evening, because they make nighttime urination worse. There are also natural techniques that improve prostate comfort. A simple pelvic relaxation stretch loosens the muscles around the bladder and urethra. Unlike cudgels, which tighten the muscles, this stretch helps relax the pelvic floor, which is important. When the prostate is enlarged, warm baths can also calm the area and reduce discomfort. Drinking more water in the morning and less at night helps. Reduce nighttime bathroom trips. Some supplements have been shown to help men with prostate enlargement. Saw palmetto can reduce certain symptoms. Zinc supports hormone balance. Lycopene helps reduce inflammation. Beta-acetostyrol is a plant compound that improves urinary flow. Pumpkin seed oil and pygeum are also commonly used. If symptoms become severe, medical treatment may be needed. Doctors may prescribe alpha blockers to relax the muscles around the prostate or medications that shrink the prostate slowly over time. In more advanced cases, there are procedures that use steam or laser to reduce the size of the prostate. Surgery is usually the last option for very serious cases. It is important to understand that prostate enlargement is not the same as prostate cancer. They are two different conditions. Many men have enlargement without cancer. However, both conditions can exist at the same time, and this is why regular screening is important, especially after the age of 50 or earlier if there is a family history. Simple lifestyle choices can keep the prostate healthy for many years. Maintaining a healthy weight reduces pressure on the bladder. Exercising for at least 30 minutes a day improves blood flow in the pelvic area. Strength training 2 or 3 times a week boosts testosterone. Avoiding long sitting periods protects pelvic circulation. Keeping stress levels low helps prevent muscle tension around the prostate. Sleeping well helps regulate hormones. Avoiding smoking reduces inflammation. Drinking enough water keeps the urine clean and reduces irritation. Regular ejaculation also helps clear built-up fluid in the prostate, which can help some men feel more comfortable. Your prostate may be small, but its influence on your daily life is large. It controls how comfortably you urinate, how well your bladder functions, and it affects aspects of sexual health too. Most problems become serious only when men ignore the early signs. Taking simple steps now can prevent complications later. The more you understand your prostate, the more control you have over your health. With better habits, better food choices, regular screening, and awareness, you can protect your bladder, your kidneys, your sexual function, and your overall well-being as you age. Taking care of your prostate today helps protect your quality of life for the future.